Blefaroespasm. Blefaroespasm is characterized by involuntary eyelid twitching with abnormal blinking or uncontrollable spasm of the eyelid muscle. Symptoms: continual or spastic involuntary blinking or contraction of the skin around the eye, sometimes accompanied by contraction of the facial muscles and the angle of the mouth. Treatment method: apply shallow oblique needling to the orbicularis muscle layer. 3 to 5 needles are usually applied to each eyelid, arranged in a row. Xiangming, located directly below the midpoint of the eyebrow in the depression inferior to the supraorbital ridge. Needle slowly to 0.5 to 1 cun along the crevice between the supraorbital ridge and the eyeball. Do not manipulate. Sanjiao 23, in the depression over the tip of the eyebrow. Needle horizontally to 0.3 to 0.5 cun. Do not manipulate. Taiyang, in the depression about 1 cun behind the midpoint between the lateral end of the eyebrow and the outer canthus. Needle perpendicularly or obliquely to 0.5 to 1 cun. Do not manipulate. Bladder 2, in the depression over the medial end of the eyebrow. Needle obliquely downward to 0.3 to 0.5 cun. Do not manipulate. Gallbladder 20, in the depression between the upper ends of the sternocleidomastoid and trapezius muscles on the level of Du16. Needle obliquely towards the opposite eye 1 to 2 cun. Manipulate with even supplementation and drainage. Sanjiao 17, behind the lobule of the auricle in the depression between the mastoid process and the mandible. Needle perpendicularly to 0.8 to 1.2 cun with even supplementation and drainage. Large intestine 4, at the midpoint of the muscle between the thumb and index finger. Needle perpendicularly to 0.5 to 0.8 cun. Manipulate with even supplementation and drainage. Sanjiao 5, on the dorsal side of the forearm, 2 cun above the transverse crease of the wrist, opposite to pericardium 6. Needle perpendicularly to 0.5 to 1 cun. Manipulate with rotation, lifting and thrusting with a small amplitude. Treat once daily, retaining all needles for 30 minutes.